Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our 6th webinar in our new series of webinars on workplace mental health and well-being best practices. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. You can download a brochure about Resilience Pro from your control box. The pandemic has certainly upended the lives of most Americans, and businesses in this country have drastically been impacted. These webinars that have been conducted so far have largely been focused on going on offense to address the impact the pandemic is having on the emotional well-being and mental health of individuals. Today's webinar is going to be about going on offense to protect employees from catching the virus at the workplace. A vast number of employees have simply gone home to work from their home office, and this is certainly the recommended strategy whenever possible. However, in many cases, this is not an option. Today's webinar will focus on the latest effective strategies for controlling the spread of COVID-19 at the workplace. Of course, that topic could cover everything from staying home if you're feeling sick, wearing masks, social distancing, and deep cleaning. However, you've already heard about those over and over. So today we're going to focus on an at-work screening strategy to keep your essential workers on the job. What makes this pandemic so dangerous is the fact that many people have the virus and can spread it but have no idea that they have it. They are asymptomatic. I have a daughter who contracted it back in March. She would have never known that she had the virus if she hadn't been amongst other workers who also had it and then tested. She absolutely had never had a single symptom, and yet was contagious and had the virus for 2 or 3 weeks. Some are suggesting that as many as 50% of individuals who catch the virus never have symptoms, but are contagious and are the key sources of spreading the virus. Right now, most of those being tested are people with symptoms and those who know they've been exposed. That leaves a lot of people who are spreading the virus who are never being tested. Until we start testing more people and the population in general, we're not going to get in front of the spread of this virus. Today, we're going to talk about how you can do that with your own employees. I saw in the news just last night that every state in the country is experiencing increasing trends in cases of the virus. We have to change from being reactive and defensive to going on offense, which is what this movement is all about. And perhaps today's discussion is one of the most important ones we've had so far this year. Well, I'm very honored to have with me as my guest panelist today, Brett Welch, who's the general supervisor at Progenitor MDX, an approved COVID-19 testing facility in Salt Lake City, Utah. His company is specifically focusing on bringing COVID-19 testing solutions and response strategies to the workplace. Brett, thank you for being with us today. Would you like to introduce yourself and share a little bit about your background and your company?
Yes, thank you for having me. It's a pleasure. I'll start with my background. I studied biochemistry and virology at the University of Utah, where I earned a PhD. And then I went on to study, some postdoctoral work at Northwestern University, again studying biochemistry and virology. And I'm pleased to say some of the work that I've accomplished in that time was one, we have an inhibitor of HIV entry that is actually entering clinical trials next month, and so we're excited about that. And also have identified some novel models for how viruses like coronavirus, particularly paramyxoviruses, so a little different category, but they have a similar entry mechanism. We discovered how viruses like measles and RSV enter cells and are triggered to initiate that initial infection event. So I find, this current situation we're in very fascinating, as well as, scary and something, that we need to take seriously and deal with. Was there anything else you'd like to know about my background?
On a personal note, Brett, how are you doing with this pandemic? I know you were feeling a little under the weather last week, but
Yes.
have you tested it okay, and you doing all right now?
I am, yes. So thanks for asking. I was symptomatic last week with just typical common cold symptoms, and I tested negative 2 times for
Great.
coronavirus. So, it's still possible just to catch the common cold nowadays, which is what that was. But I have also, like you, been personally affected by this. My son, actually, similar story to yours, was tested positive for coronavirus, and you wouldn't have known. You just had a sore throat for maybe one day was all, and pretty asymptomatic after that. But the test caught it and was able to keep him home from school and prevent him from infecting classmates and so forth. So, but
Nice.
yeah, we had to quarantine and everything. So, yeah.
Well, I'd like to start today's discussion by talking about a study that was found in the Journal of American Medical Association. By the way, this article is available for you to download right now through your control box. The title of the article is Assessment of SARS-CoV-2 Screening Strategies to Permit the Safe Reopening of College Campuses in the United States. Although the study was done for college campuses, the study findings are most relevant and apply to workplaces as well. The study looked at using poorly sensitive but inexpensive and quick response screening tests proactively to identify individuals with the virus who can then be further tested with a PCR test, which is a more expensive test and takes 24 to 48 hours to get results to validate if in fact they're positive. The study looked at the appropriate cadence to administer the screening to maximize the effectiveness of the screening tool, but also minimize the number of people that needed to be isolated in quarantine. The sample was 5,000 college students, and the study modeled out an 80-day semester looking at 1, testing everybody every day, 2, testing everybody every 2 days, and 3, testing everybody every 7 days. Let me show you on the screen what the results of that study were. So they found that everyone that was tested on a daily basis, there was an accumulative number of infections of 162. There was a mean daily isolated census of 116, and 21 or 18% of those 116 were positive for COVID. The every 2-day approach found that there were 243 cumulative infections, only 76 people were the mean daily isolated census, and the true positive results were 28 or 37%, so just barely more than the everyday. The every 7 days found 1,840 that were positive, 121 were isolated on a daily basis, and 108 or 90% of that were actually truly positive for the virus. So the recommendation from the study is that a cadence of every 2 days with an inexpensive quick response screening to identify people who may have it, who you can then quarantine, but then do a PCR test to validate whether they truly have it, was the best solution. So Brett, as you and I have discussed this, the best practice strategy for companies to participate in would be to involve everyone in a population tested with a PCR test at the beginning to make sure you identify any positive cases in the group, and then keep them home until they test negative. Then use the antigen, inexpensive, rapid test every 2 days to test everyone as they come to work. For example, every Monday and every Wednesday. And if you could manage a 4-day work week, it would be a true every 2-day strategy. Those who screen positive would receive an additional PCR test to be sent home until the results came back in 24 to 48 hours. What this does is identifies early those with the virus as they begin to be contagious and avoids having to send everyone who's had contact with them in the last 5 to 6 days home to quarantine, which is perhaps one of the currently most devastating effects that this pandemic is having on companies who have to be in manufacturing, have to have people at work. It doesn't take long before you've got everybody on quarantine and no one's at the work site to do the work. So give me your thoughts on this strategy, Brett.
Yeah, it's a really good strategy. If you were to implement this, you would really be able to control infection in the workplace. Um, Kind of where to start. I guess, one place to start would be with the initial testing, the PCR test that's recommended. Why do you need a PCR test if you're going to test, daily or every 2 days with the antigen test? And the answer to that is that these tests aren't perfect. Both tests are good and they serve their purpose, but the tests aren't 100%. Nothing is perfect, right? So the you know, based on the background positivity rate in a population, you can sort of estimate how many tests that you might expect an antigen test to not detect, right? So for example, if you test 100 people and there's a 20% positivity rate on average in the general population, as there is right now in Utah, then and there's a 5 or 10% false negative rate from the antigen test, then if all you did was antigen test, you would let one or two people through if you just did that. So the idea is to get a really high specificity test up front with the PCR test to get a negative baseline for your antigen testing. And once you've established that negative baseline for antigen testing, then you can proceed with that and know that you're so starting from no cases instead of 20%, you're not going to let any slip through. And so the combination of that strategy seems to like a really good strategy for eliminating any cases in the workplace. And so you get your background rate down really low to begin with, and then you follow that up weekly or twice weekly, ideally with the rapid antigen test, and that will go a really long ways towards minimizing spread in the workplace.
So let's talk a little bit about how long it takes. So the PCR test, which is the gold standard, which requires a high level laboratory to process it, it's going to take generally 1 to 2 days, right, to get that result back, but it has the highest level of accuracy.
Correct. Yep.
And as you're doing those, what are you finding? Are most of them able to get results within a day?
It depends on the laboratory. Currently the state-run laboratories and other ones that aren't necessarily run by the state but are associated with the state, like Test Utah, they are very busy laboratories right now. They're processing thousands of tests a day, and I have not tried to do this personally recently, but I've heard that they're scheduled out a few days for even just to schedule a test right now.
Just to get the
Then,
test.
right. So you might be a few days to get the test, and then you're going to be a few days, to get the results. I think if they're turning results around in 3 days right now, that's pretty heroic. I think maybe during extremely busy times like right now, 24 to 48 hours is not really achievable with most laboratories. I'm happy to say that with Progenitor MDX right now, we are able to do that. So we have a little bit different business model. We're not mass testing, positive or symptomatic people, for the state. But we, like you introduced in the beginning, we're really trying to work with companies to try to test their workforces and be able to safely work. And so we have a lower throughput, a lower volume of testing coming through our laboratory right now, and we are able to turn around results in usually 24 hours.
Well, and maybe you could talk a little bit about how that works. I know you've been coming out to our work site on a weekly basis to test our staff. It's pretty convenient. It's pretty easy to do. Talk a little bit about the method of testing that you're using. And I think in every case, we've been able to get results the next day.
Yeah. So yeah, good questions and good points.
And by the way, before you start, let me just mention to our attendees, because we have a number of people on our webinar today, please feel free through your control box to ask questions. We'd love to field questions from you as well.
Yes.
Go ahead.
Yeah, so I think people know by now there's all kinds of different tests for this. There's the deep nasopharyngeal swab that is sort of legendary for being uncomfortable and you know, not being uh, the most comfortable test method.
Right.
But it is, you know, a highly accurate way to get a sample. The other, you know, side of the spectrum might just be the saliva test, where you can just, you know, give a saliva sample. But I have personally done that, and what I've found with that is that, you know, you can't, you're not supposed to eat or drink anything for 30 minutes beforehand, and then it took me about 5 minutes to collect that saliva sample. And so I personally am not the, you know, the #1 fan of the saliva collection method, although it works very well as well. Our laboratory has settled on what my preferred method, which is a shallow nasal swab. It's called an anterior nares swab. The swab just goes, you know, a ½ inch inside the nostril, just enough to make the flocked portion of a
Enough
swab.
to tickle you.
Sorry?
Enough to tickle you.
Yeah, enough to tickle, but
The only
not to be,
downside is the tickles.
not to be uncomfortable, you know. So
Yeah.
so yeah.
Much better to be tickled than to be hurt.
Yeah, but the nice thing about that one is, you know, it can be a self collection, and so you know, you're in control of collecting. If it's tickling too bad, you can pause for a moment and, you know,
Right.
turn away to sneeze or whatever you need to do. And I found it makes about 10% of people sneeze.
Mhm.
Or another way to say that is it even makes me sneeze about 10% of the time. So it maybe just depends on the day or whatever, but it's not super uncomfortable, and it's fast. You can collect a sample in about 30 seconds without a lot of discomfort. It's self-collection. And one reason that the CDC likes and recommends, and I should say too, it's been found to be, you know, comparable in accuracy to the deep nasopharyngeal swab. And one reason the CDC likes it is because with the self-collection and with not, you know, being you know, such a deep swab, it doesn't produce sneezing and coughing as often, and you can actually get away with, you can even, you know, and you're supposed to sort of socially distance while you're collecting the sample, and you can get away with using less stringent PPE, so the protective equipment. And you're less likely to be spreading, you know, the virus around the collection site using this method. So it's my preferred method. It's pretty comfortable. So that's how you start. It's pretty easy to do. Like I said, fast, and you know, you walk up with and get your, you know, QR code scan and get a tube, and the, you know, tube barcode gets read and associated with your sample, and then it goes to the lab where it gets tested with the PCR test, and yeah, it's about 24-hour turnaround for our lab right now.
Well, and correct me if I'm wrong, but aren't there billing codes now for both the antigen and the PCR test, so the test could very well be covered by insurance?
Yeah, I'm not an insurance expert, but I know enough to you know, to say with confidence that you know, if you have a known exposure or you're symptomatic, that insurance companies, like it's a federal mandate that insurance companies cover the cost of that test. If you're getting tested for screening purposes only, that's a little more, you know, vague. It's not mandated that be covered. It might be depending on your insurance, but it's not, you know, guaranteed to be at this point.
Great. Talk a little bit about your company's services in dealing with the response to a positive test, such as company policies, contact tracing, because you do more than just the testing.
Correct. Yeah. So Progenitor, you know, we are a concierge service, and we offer, you know, different levels of service depending on what's you know, desired by the company, essentially. And we can do everything from the testing to helping people develop a management strategy, to even helping them with the contact tracing, if a positive test result is found. We know that the best strategy for or the best thing we can do in terms of a positive test result is report it fast and make sure that the person is informed of the result. And so we send out an email, and then we also do follow-up calls with positive test results so that they know as soon as possible that they need to quarantine and so forth. And then yeah, we can go in and do anything that's desired to help the company sort of manage their COVID strategy.
Great. So do both the antigen and the PCR test need to be reported to the state in most states? And if so, then is the health department getting involved with some of the contact tracing?
Yeah, that's correct. Both test results need to be reported to the state, and ideally the health department is getting involved, but they of course have to triage their involvement at this point. And so you're not, if the average Joe is not likely to get contacted by the health department for contact tracing at this point. So for example, when my son tested positive, we wondered if we might receive that phone call from the health department. We did not. So we proactively contacted the school, let them know that our son tested positive and he's going to stay home on quarantine and so forth. So everybody has to do their part in this, surge time with the
difficult time. So talk a little bit about companies that are not in Utah. Between the two companies, our two companies, really this service is available to any company anywhere in the country. It's not just Utah-based companies. Talk a little bit about how you expect and intend to kind of branch beyond just Utah.
Yeah, so currently for us, I'm now you should speak to Orion's capabilities, but for us, the test it's by prescription only. And what that means, basically, you don't have to see our medical director before getting a test, but you do have to fill out a questionnaire, which will ask some questions about symptoms and exposure and so forth. And then, based on the answers there, it will be deemed billable to insurance or not. And then from there, so I lost my train of thought. Where would you want me to go with that?
Expanding beyond Utah.
Beyond Utah. So my point there was that the prescription that gets generated when you fill out the questionnaire, it sort of automatically gets generated, but it's through our medical director whose license is in Utah. So it covers the entire state of Utah at this point. But we need to still expand beyond the state, and we're working on doing that right now. We're working with other medical professionals that can, produce a prescription in other states, but we have not expanded yet outside the state of Utah. So you should talk about Orion's capabilities to do that outside the state.
Right, and clearly what we do at Orion is we do testing of all kinds of on-site work testing, whether it's COVID or biometrics or heart health. Across the country, we're a CLIA-waived licensed lab and can do testing in, I think, all but like 4 or 5 states. And the plan is that we could actually be the ones that go out to do the testing and collect the samples or identify local individuals, especially if it's going to be an ongoing regular testing procedure, to do those under our license, and then work out arrangements with physicians locally. Talk a little bit about the prescription. If you're going to proactively just screen everyone, is it really just a billing issue, and it's probably going to be more of a cost to the company? There's no reason why a company couldn't just pay to have everyone tested, even if it's not a prescription by a physician, correct?
That's correct. And in the current situation with being sort of a high positivity rate in our population, it's really quite justifiable to do screening. Some of the state laboratories have triaged to just testing, people that are symptomatic or exposed only. We have capacity to do screening still more broadly, and with the high positivity rate in the population, the CDC has actually requested that we do more screening. And so we're still able to do that and focus on that for companies. That is our business model.
Great. Again, we would invite anyone that might have questions that are participating in our webinar today. If you've got a question for either myself or for Brett, please send those in. Brett, what have we missed covering today? Is there anything else you'd like to share with our attendees about this whole COVID and the idea of being proactive at the work side and actually doing some screening on a regular basis to keep the population clean?
I think, I would add to this that, it's not testing only. Definitely, as we've discussed, and the studies have shown that we discussed, the testing has a very important role in controlling this in the workforce, but also very important is behavior. So the testing needs to be combined with strict behavior. So mask wearing, social distancing, hand washing, hand sanitizing. Those are the things that also need to be done strictly in conjunction with testing to really get this thing under control. If we do that, the modeling and the mathematical models show that we can turn the corner and contain this, but it requires everyone sort of doing their part. And so one of the statements from the study that you highlighted earlier in the JAMA article is that this is a quote from the article. They said, "We identified no circumstances in this modeling study under which symptom-based screening alone would be sufficient to contain an outbreak." So you can't just, test people with symptoms. You have to screen
And then
test
forget about it.
Right. And another quote that is in here basically is that there is no way to do it without strict adherence to the behavioral elements of this. So we really need both, but together it does have the power to contain this and get ahead of it.
Well, and like we said at the very beginning, there's certainly those who can work from home and should.
Yep.
It's really those companies, manufacturing type, or healthcare type facilities that require you to be at work, and there's that need to be there. Obviously, social distancing and putting up barricades and things that can keep people apart is a great way to go about that. But with the screening strategies combined, you can send your employees home with peace of mind, which is clearly what you're trying to do in running a business where you have to have essential workers at the work site, is be able to help them feel comfortable that they're coming to a safe place, as safe as you can make it, and that you're doing that in a proactive way.
That's right. And if you've done that, if you've established that precedent in the workplace, it's likely to, follow, I think, employees home. If they know that they have this sort of safe, bubble created in the workforce, then they're not going to be anxious to, sort of break that bubble and expose themselves at home either. So I think the behavior in the workforce can affect how people behave at home, and then that just reinforces, the safety for everyone. So
nice. So we just had a question come in. Let's address that. As a small company of about 50 employees, how do we get the test to give to our employees, and what is the cost of each test? So we actually go out to the work site and do that. Please feel free to give us a call. Again, the handout that's available through your control box has the phone number to reach Orion, and we can combine our services with Progenitor MDX. And in terms of the cost, it's approximately, or just a little under, $2 per employee per hour to be able to have a comprehensive ongoing testing policy in place for your employees. So it'll give you an idea as to what you're looking at in the way of a cost as an additional $2 per hour per employee to be able to administer this kind of an ongoing strategy. And of course, the cost does vary based on whether you're pooling people or you're doing people on an individual basis, as well as the number of people and of course the location of. So there's a number of factors that come into play, but about $2 per employee per hour is what it'll additionally cost to implement this type of a comprehensive screening strategy. All right, we're coming to the end of our 30 minutes, so not seeing any more questions. I want to thank you, Brett, for participating with us today. I'm going to just mention that our sponsor again of this series of webinars is Resilience Pro. Feel free to download a brochure about Resilience Pro from the control box. Our next webinar will be on Wednesday, November 25th. Join us as we discuss how companies can regularly monitor the well-being of their workforce. Please join me on Wednesday, November 25th at 9 a.m. Mountain Standard Time. As a reminder, the recordings of all of these webinars can be found on goingonoffense.com. The website also contains a host of other ideas, suggestions, resources, and helps for organizations that want to provide emotional well-being support to their employees during these difficult times. We suggest you check them out. Brett, thank you again, and we wish everyone a wonderful day.
Have a great day. Thanks.
Thanks.